Hi, I am Dr. Thomas Scotton's avatar. Welcome to Lesson 15 of the Family Caregiving Program. Today, we are covering a critical skill, taking vital signs at home. Accuracy is our focus. Before we dive in, please note that these lectures are for educational and informational purposes only. This content does not constitute medical advice, therapy, diagnosis, or treatment recommendations of any kind. All caregiving decisions should be made in close consultation with the individual's physician and qualified healthcare professionals. Our purpose is to teach you how to measure temperature, pulse, blood pressure, and respiratory rate accurately. You will also learn to recognize meaningful changes, document trends, and respond appropriately to concerning findings. By the end of this lesson, you'll be able to prepare the environment and equipment correctly. You will learn to measure all 4 vitals using the chosen device and site correctly. Finally, you'll know how to record results consistently and identify when symptoms require emergency help. A key principle to remember: vital signs are observations, not diagnoses. They are pieces of a puzzle. Always use your clinician-approved monitoring schedule and baseline ranges for your loved one. If you see an emergency symptom, never delay calling for help just to repeat a measurement. Section 1, Accuracy before interpretation. Vital signs offer a quick picture of how the body is functioning. Their value depends on accurate technique, consistent conditions, and comparison with a person's usual pattern. Factors like activity, anxiety, caffeine, or even a full bladder can cause unexpected numbers. Variation might also come from poor positioning, the wrong cuff size, or a simple device error. We respond by looking at the person first, then checking our technique and repeating when appropriate. Always compare the result with their baseline and follow the specific care plan provided by your doctor. Crucially, a normal-looking measurement does not override serious symptoms you might be seeing. Chest pain, severe breathing difficulty, or signs of a stroke require an immediate call to 911. Also, watch for blue or gray skin color, seizures, or collapse. Don't wait, call for help immediately. To ensure accuracy, set up a reliable routine in a quiet, comfortable room for measurements. Use clean, appropriate equipment and always keep spare batteries available to avoid device failure. When trending vital signs, use the same device, site, and position whenever possible. Taking measurements at the same approximate time each day helps reveal true trends over time. Record any recent activity, symptoms, or medications that could explain a change in the numbers. Before you begin, always explain what you are doing, obtain consent, and provide for their privacy. Section 2, Temperature. Let's look at the correct sites and techniques for measuring body heat. Normal temperature varies, but many healthy adults fall within 97 to 99 degrees Fahrenheit. A temperature above 100.4 degrees Fahrenheit usually warrants attention as a fever. However, older adults might show infection through smaller rises, new confusion, or weakness instead. For an oral temperature, ensure the person hasn't had a hot or cold drink or smoked recently. Place a covered probe under the tongue toward the back. Close the lips and wait for the signal. For forehead thermometers, the skin should be clean, dry, and out of direct sun or strong drafts. Hold the device perpendicular at the exact distance specified by the manufacturer for the best results. Call 911 for a fever combined with severe breathing difficulty, confusion, or extreme pain. Section 3, Pulse. We will now cover how to assess rate, rhythm, and strength. For most adults at rest, 60 to 100 beats per minute is the common reference range. Many things can raise or lower the pulse, including fever, pain, anxiety, and even medications. To count the pulse, place your index and middle fingers over the radial artery on the thumb side of the wrist. Do not use your thumb. If the rhythm feels regular, you can count for 30 seconds and multiply by 2. However, if the rhythm is irregular, very slow, or very fast, always count for a full 60 seconds. Beyond the rate, note whether the rhythm is regular and if the pulse feels strong or weak. Call 911 immediately for pulse changes accompanied by chest pain, shortness of breath, or fainting. Section 4. Blood pressure. Technique is everything when it comes to getting an accurate reading. Systolic is the top number, and diastolic is the bottom. Standard normal is below 120/80. Remember that treatment targets are individualized based on history, like kidney disease or diabetes. Choose a validated automatic upper arm device. Wrist and finger monitors are often less reliable. The cuff must match the arm size. Too small can read high, too large can read falsely low. For 30 minutes before the reading, avoid smoking, caffeine, and exercise. Always empty the bladder first. Seat the person with their back supported, feet flat, and the bare arm supported at heart level. Wrap the cuff snugly above the elbow crease with the artery marker correctly positioned. Remain still and quiet. A reading higher than 180 systolic or 120 diastolic is considered severe and warrants immediate action. A reading higher than 180 systolic or 120 diastolic is considered severe and warrants immediate action. Section 5. Respiratory rate. This is the number of breaths a person takes per minute. A common resting range for adults is about 12 to 20 breaths per minute. One rise and fall is 1 breath. Count while the person is resting and unaware. People often change their breathing if they know you're watching. Note the rhythm, depth, and effort of each breath. Watch for any sounds like wheezing or grunting. Call 911 for severe gasping, inability to speak, or if the person's skin looks blue or gray. Section 6. Document, trend, and communicate. Consistent records are vital for your clinician. Record the actual measurement immediately. Include the date, time, device used, and any recent activity. A trend like a rising temperature or falling blood pressure is often more important than any one single value. When reporting a concern, use the SBAR framework to communicate clearly with the healthcare team. State the situation, give the background and assessment, and then make your specific requests. Let's finish with a knowledge check to reinforce what we've learned today. Question 1. What preparation improves a home blood pressure reading? Avoid caffeine, rest for 5 minutes, and sit with feet flat. Question 2. What resting heart rate range is common for most adults? 60 to 100 beats per minute. Question 3. What temperature most often indicates fever? Above 100.4 degrees Fahrenheit or 38 degrees Celsius. Question 4. How do you count 1 respiration? 1 complete rise and fall of the chest or abdomen equals 1 breath. Final question. Should you delay calling 911 to repeat a vital sign? No. Emergency symptoms always take priority. Home vital signs become powerful when technique is accurate and the numbers are connected to the whole person. Thank you for completing Lesson 15. Please download your lesson workbook and bring your log to your next appointment. This course is for educational purposes only and not medical advice. Consult your clinician for specific caregiving decisions and emergency contact instructions. Lesson complete.